The stalwart little band of B12 investigators, there's comfort in knowing that the stream of important scientific questions will never end. And I think I've always been amazed in my research how little we know, even about that narrow little branch of medicine. So yeah, I think there's an awful lot still to find out.
Just around that one issue alone of whether or not a person should be deemed to be deficient in B12 deficiency needs to be revisited.
The cost implications of misdiagnosing vitamin B12 deficiency are enormous, both for healthcare providers and national economies. Whilst waiting for treatment, the patient will often be struggling with workplace issues and will be taking time off work to make numerous visits to their doctor, using up valuable consultation time. But it is the social costs that cause the most problems. Some patients will have little or no social life in the evenings, have emotional and personal relationship problems, and, depending on how severe the symptoms are, might have to make life-changing decisions in their career.
Started feeling really unwell, and started again going to the doctors and saying I felt tired and my concentration levels were 0, and they said that it was depression. Everybody gets tired. And when I went the last time, she actually referred me to a counsellor and said that I needed to talk to somebody about my problems. And I said, but I haven't got any problems, I just don't feel well. And it literally took me going there and demanding tests. And the results of those tests came back and they were so bad that I had to go down straight away and have an injection because of things going wrong. I lost the use of my legs. And even, it was just diabolical, really.
It took them a good 10 years to actually get round to deciding what it was from when I really started feeling pretty awful. And I saw all sorts of consultants and people at the hospital who did all sorts of things with cameras and various things to me, but they never sort of came up with anything until about 10 years after they first started. So no, it just dragged on and on and on.
I've not been accepted that there's anything wrong with me, and I'm the sort of person that if something is wrong, then I want to deal with it, manage it, sort it and move on, and I've not been allowed to do any of that.
I was getting anxious, really anxious about the condition and the fact that I was getting worse. I felt my limbs were getting worse, my hands, this tingling, my feet and my hands, it was starting to creep up my legs. Very alarming. I'd gone from never having anything like that before to then all of a sudden being swamped by these sensations, and it was not at all pleasant.
And all the while, whilst waiting for definite diagnosis, the patient risks developing serious and irreversible nerve damage.
You have to realise is that you need energy to be enthusiastic, to want to do things, to want to feel things even, to want to feel things for other things. I'm a painter. It is so sad when I can look back and think, those 3 years, I didn't have the energy to hold a paintbrush. I didn't have the enthusiasm to even think of doing it. But what could I have been doing those 3 years? This house changed from a fun place where everything went, anything could go, pandemonium, to a sickness place. I have a son, and he rang up every day to know how I was. And he said one day, Mum, he said, if I could give up a year of my life to have you back as you were, I would. And that is how very ill you can be with pernicious anemia.
I realised how ill I was before I got diagnosed, how much time I wasted, what cost it would have been to the NHS because of the amount of appointments I feel I wasted, because they should have done something a lot earlier.
We want medical professionals to come to us so that we can show them the results of our online survey, so that we can show them the stories of misdiagnosis and non-diagnosis that's on the forum, so that they can see our letters that we receive daily from people who have had terrible problems with being diagnosed.
What is happening to the rest of the population who are suffering from B12 deficiency? I cannot even imagine the suffering they are going through.
I just want those tests introduced so that people can get the treatment they deserve, because when they test people like me, we come out okay, and we know we're not okay.
It should be the standard of care that people that present with signs and symptoms of B12 deficiency have to have it ruled out. And I feel because there's such a knowledge deficit and such a resistance from the medical community, perhaps the government needs to get involved, because maybe if they realize the financial savings, we need to attack this together.
Yeah, from what I've read about it, I'm aware of it. I have to say I haven't been lobbied on it other than by one or two organisations. I haven't said my postbag is bulging with people who have said, look, I've presented at my GP surgery and I've had an issue about getting a correct diagnosis, because many people are diagnosed with symptoms of depression, of ME, of MS, instead of having the correct diagnosis and then put on the correct treatment path to remedy the situation so they can get back to work, they can be productive and obviously start feeling on top of themselves. And so I think what we need to be doing is obviously make sure that we are aware as politicians of the situation that is out there. We need to be talking to the medical profession to understand why this misdiagnosis is going on, and then we need to be working with our constituents and the people of Wales to make sure that we put the services in place.
I find it quite amazing actually, because especially in these days when we think we're very good at research and medicine, we're so much better than we were in the past, and yet to find that so many people could be suffering needlessly is quite astonishing, and for something so simple. And that's the really sad thing about it. We're talking about spending thousands of pounds on some drugs in 1 year for people, whereas a relatively small amount of money could actually enhance the life of so many people, and it appears save the NHS money as well at the same time. So I just think we really need to look into this in a lot more detail.
As far as treatment is concerned, if someone's got pernicious anemia, the treatment is laid out, it's standard. They'll get loaded with B12 by having a series of perhaps half a dozen injections over a few weeks, and then continue with one injection every 3 months for life.
There are the issues with the treatment of pernicious anemia, which used to be treated using raw liver, and now thankfully we can have injections. But the way in which we've been treated has changed. We know that in 1960s, people were treated every month with an injection. That changed in 1974 to every 2 months, and 1984 to every 3 months. I have to tell you that the most common cause of concern amongst our members, the number one issue that our members phone us about, is the frequency of the injections.
I feel good for a couple of days after I get an injection, and then I gradually go down in the timescale before the other one is due.
For the first week I'm fine, and after that pins and needles start, my feet go dead, my mouth goes numb, my fingers, I'm back tired, I'm back irritable, just back to where I was the week before I had the injection.
It's really purely done by the book. The book says 3 months, so you have a 3-month injection, and that really is all the doctor wants to know.
It breaks my heart every day. I go to bed with such a heavy heart.
Sometimes, where a doctor refuses to depart from the guidelines that set out the frequency of the injections, it can lead to an irreversible breakdown in the doctor-patient relationship.
I went on to the 3-monthly injections, and after a few months I said, can I have it a little bit early? And he said, no, you have it at 3 months. And that's it. He just would not listen to me.
I had to fight to get my injections as regular as I need them to be. I mean, ideally I'd like them every month, but that's not going to happen. I managed to squeeze it to be in every 6 weeks. But the mere fact that I went and asked for it was like, well, what do you do in asking this? I'm the doctor, I know everything. And it was this real sort of, I really felt like I was up against someone who really wasn't sympathetic.
We are routinely told that when our members go and to the doctor and say after a month, I need another injection, they said, no, you don't, you need antidepressants. That happens all the time. I was told when I wanted an injection before my 3 months was up that I should have antidepressants.
However, there is evidence of some patients who seem to recover from the symptoms of pernicious anemia and B12 deficiency while on 3-monthly injections.
It had a bit of a miraculous effect, and really after just a couple of weeks I was starting to feel better. And then since then I've gone on to the 3 monthly injections, vitamin B12 injections, and it probably took me around about 6 months, I guess, before I think I was really back to where I wanted to be at that point in time, and yeah, have since gone on to sort of resume the previous life that I'd got before that point.
Why is it that people are still symptomatic even after treatment has started? Why are some people not symptomatic when treatment has started? And why some people are still symptomatic and have to make life-changing decisions that can affect their career and their families because the replacement therapy is not doing what lots of doctors think it should do.
Everything is horrible. Everything about my body feels awful, painful, fogginess, not being able to think properly, just feeling tired, sleepy, feeling I don't want to be asleep at 9 o'clock in the morning or whenever. I want to be awake. I want to enjoy this day. This is my day, my life, and I'm sleeping.
It was, you know, I couldn't begin to tell you just how negative, how cocoon, how miserable. It wasn't a laziness, it was a fact that you felt so guilty in a way, I should be doing this. Why aren't I doing that? Well, did I do... Oh. I mean, I should be... But the minute you tried to do anything, you just collapsed.
Just don't get up and go at all. You just want to go to bed, basically, and do absolutely nothing. It's very annoying to your wife and family and people when you just don't want to do anything. You just want to give up and stop, and you do get depressed and fed up.
I don't know what's going on. I'll need continual reminding of things. I'll forget to do stuff, and it's the tiredness. The tiredness is like trying to move through treacle. Like everything is really sort of difficult and hard.
Parts of my mind just don't want to relive it at all. I want it to be gone from my memory. I don't want to carry it with me, even to talk about it. Although I try, and will try to give you a description, sort of a glimpse into hell.
Listen, I thought I was dying. You know, you don't know what it's like. And you think, you know, is this what it's like when you're dying? You know, you're getting worse and worse, and then you have a day that's not too bad. Oh, I'm getting better. But then you do a bit, and then you're back down again.
My second marriage is not stable because of the amount of time I spend sleeping, and I'm tired, and things I can't do.
My marriage breakdown, I think, was probably the worst thing, and it was due, I think, because I just didn't have any energy to do anything.
I'm just afraid now. I'm afraid of my PA. I feel that if I were to have proper B12 treatments, then that would get me up and running and living again for a standard of life, never mind quality, and then I could go out there and get a job. Because I'm left like this, I am actually useless.
Bad days are wasted days because I again feel I have no need to be feeling bad when there's so much that could be done to help me. You know, it just beggars belief that nothing's been done to help people like me. Not only me, but the many thousands of people with pernicious anemia who are the invisible people with the invisible illness that nobody's recognising as having anything wrong with them when we all are suffering. And it's just not on, it's got to stop. And the bad days should stop too. And only with treatment of B12 and enough treatment to flood my system can I possibly enjoy all good days and very, very few bad days.
It's no wonder that patients in the UK are feeling tired and fatigued and confused by the end of their 3 months because it's long gone from the system. Even 1 month may be too long. I think you should go based on the patient's symptoms.
I think the problem is there's a tremendous rigidity and dogma in the field, and the dogma is that you give B12 injections every 3 months and that's it, and that should be enough. Maybe enough for some people, but it appears clear that it's not enough for everyone. And I think this is a matter that needs to be looked into by the medical profession and scientists. Why is it that some people quite clearly need it more frequently, It may not make sense in current medical knowledge, but I think that is telling us that we don't know enough about B12.
I think it's very sad that the National Health Guidelines, I mean, National Health is a wonderful institution by and large, but this is a grey area. I'm so sorry that the National Health Guidelines are one jab every 3 months, if they can get away with it. Well, I couldn't.
I feel like a prisoner within myself, and I want to get the key to get out the prison, because the key is getting more injections to get out of this prison that I don't need to be in, and I'm kept here against my will, and the NHS is keeping me here against my will.
The injections are usually, if you look in the BNF, it says to give 3 monthly, but you very often find that patients know that they need their injection before that time. And so often, once I've repleted B12 in the body, I often say to patients, you come along when you feel that you need it. And it often turns out to be monthly, sometimes even less. I have a colleague in Sweden who sees even more resistant cases and can give B12 several times a week to some of these patients. I haven't patients like that myself, but they do exist, patients who seem resistant to B12. And why that is, we don't quite know.
I'm still on 3 injections a week, but I keep very, very well on it. I'm also on daily folic acid. I can't stop either. I've been taught how to self-inject, and I can do that at home now, which makes things a lot simpler. And as long as I stay on this regime, I keep really, really well.
The problem with the frequency of injection also promotes inequality in healthcare. There are those people who are made to suffer the 3 months regime, whilst there are others whose GPs will say, oh, you can have them whenever you want because you can't overdose on them.
The regime itself is not adequate, but I was very fortunate to have doctors who didn't just give me that regime, but actually looked at me as an entire person. They could see that I clearly had major symptoms, and they were more interested in treating these symptoms than just applying a sort of one-size-fits-all regime that wouldn't have done anything for me.
I have a patient, 16-year-old, paralyzed from knee down. Her level, B12 level was 243. Not many doctors will treat somebody at 243. The hospital didn't treat. But when they couldn't find a cause, she was discharged home with no diagnosis, no treatment. I started treating her. In 9 months, she threw the crutches away and walked.
Massive improvements. Energy levels restored to almost normal. Memory problems are not completely away, short-term memory problems, but instead of not even remembering people spoke to me at all, I can remember that they did at least tell me the thing, even if I forgot about it later on. So definitely an improvement there. My walking is better because my balance problem is sorted out. I just feel more alive, to be honest.
When I studied physiology, they said the most important elements are oxygen, water, salt, which is sodium, and potassium. I say the order is different. Oxygen, water, and B12.
What we've discovered from looking through the academic papers is that amongst the UK population, probably somewhere around 40% of the population has a propensity, is likely to suffer from B12 deficiency if they don't get enough B12 from the diet. That's an enormous proportion, that's 2 in 5. What we've observed within Shinwell is that around 20% of our patients respond to B12 replacement therapy. And that's really quite important. We're not talking about people who we've diagnosed as having B12 deficiency on some spurious grounds. We're talking about people who, when they receive B12, their symptoms go away. They're better. They go back to work. They stop being anxious. They stop being depressed. They start enjoying their families. They start enjoying their grandchildren.
Well, you're going to be causing poor health, injury, fall-related trauma, neurologic injury, cognitive decline, where a person can get dementia, where you're going to have to put them in assisted living or a nursing home, which is very expensive. In the U.S., it costs like $75,000 a year to take care of someone with dementia. If you get a hip fracture, it's very expensive, and they could end up in a nursing home. So there's billions of healthcare dollars that are being wasted. Not only that, but if a person comes in that's symptomatic of B12 deficiency, for instance, it causes depression, and you put a person on an antidepressant. Some antidepressants cost $1,000 to $2,000 a year. Now, does that make sense to use, you know, our money privately, say if you don't have insurance or you're using insurance or governmental insurance, that we're paying that kind of money when a person has simple B12 deficiency, where it would be a lot cheaper. You could treat a B12 deficiency for $36 a year, giving self-injections, versus spending $1,000, $2,000 on antidepressants.
It's like a lot of illnesses, diabetes, for example, as well as anemia. You can put the global figure, and they are quite startling. They are. And in a Welsh context, I would have thought the 800,000, which you've talked about, is a UK figure you've talked about. So if you scale that back on a proportion of the population that we have of the United Kingdom, I mean, 8 falls are 48. That's roughly about 48 million in Welsh terms. That is then, and, you know, that is a massive sum of money for the Welsh economy to have drained out of it. And if there is a solution, and from what I'm led to believe, a relatively cheap solution to solve this problem, you know, for the sake of spending a small amount of money, we could be saving the Welsh economy a huge sum of money in productivity, but also in self-esteem for people who suffer with B12 anemia, because obviously if people feel tired, they feel debilitated, and they don't feel productive, it suddenly affects their self-esteem and their morale, and above all, it affects the family environment and the community environment that they feel that they want to play a part in. And so it's economic, yes, but it's also the personal aspect as well of what is being inflicted on people by not having the correct diagnosis and not being able to be put on the correct treatment paths. And that is something we should be addressing, because preventative action is far better